If you've ever had your back go out, you know how debilitating and scary it can be. Thank goodness there's an amazing treatment called NUCA to help. It'll nurse you back to health. It'll help you get better. And Dr. Jamie Kaiser from Back to Balance is here. He does the treatment. Patient Lisa Moctezuma is here. And you are testament to that this really can help transform your life and get you back into balance.
Absolutely. I'm very appreciative for the treatment. I had a terrible back problem and I could not find any relief, and I finally called Back into Balance, and I was very happy to get help.
We're so happy, and we're going to hear your whole story. But Jamie, for folks that are joining us that may have never seen your bright, shining, smiling face before, NUCA is a chiropractic treatment, but completely different from what we generally think of as chiropractics.
Yeah, NUCA itself is a very specific form. It's upper cervical. What that means is we are working with proper alignment between the head and the rest of the body. And it's pretty funny because I had a patient that was in probably about a week ago, and she brought her, there's a new patient came into the office, and her 2 kids were with her, about 5 years old and 7 years old. The kids understand how this stuff works. We as adults make it too complicated. You talk to a 7-year-old, you ask them, where do all the signals in the body come from? You know, if I wiggle my fingers, if I wiggle my toes, everyone knows it comes from our brain, and it comes from our brain down and out. And so I asked the 7-year-old, I'm like, well, if I put a big knot up top here, is that going to make things better or worse? He's like, well, it's going to make stuff worse. I was like, well, is your body self-healing? If you cut your finger, what heals the cut? He goes, well, is it the Band-Aid? No, it's my body. You get proper alignment up here so that the brain can communicate properly, the body works better.
Now that 7-year-old works at your office.
Exactly.
He's so smart.
Child labor laws, but you know we pay him under the table. So
No problem. So NUCA is something that can help with people that have headaches, people that have back problems, anything from vertigo to spinal issues.
We've been doing the show, what, probably done about 25 shows at this point. I mean, if you go to our website, we even have a search bar up at the top where it says, can NUCA help with? You go and you type in autism, you type in multiple sclerosis, you type in vertigo, tinnitus, you'll land up on some videos we've done of patients that talked about their experience with what NUCA did for them. Let's make it simple, let's make it bigger. You experience life through your nervous system. If you're seeing me on TV right now, if you're hearing me talk, if you're sitting on your couch and feeling that you're sitting down, your nervous system is letting you experience that. And we allow your body to work right, so your nervous system works right, and things get better.
And it's
Simple.
a very gentle procedure. I've been to a chiropractic many times, and you know, you hear the pops, the clicks, and kind of wonder what in the heck is going on. Yours is so gentle, it's really not even stronger than your pulse
being taken. As we can see, the video's up right now. The most amount of force that you feel, again, if you've ever had your pulse taken, we're talking about slightly more pressure than that. The correction itself, again, as we're showing here, is done only to that upper head neck area. So, you know, as Lisa will talk about, her main complaint, I guess, coming in was a really bad lower back. We actually corrected her body by doing the exact same thing we're doing there. I'm measuring out, figuring out where I have to stand so that I've got the math, the leverage, the physics on my side so it doesn't take tons of force to move things back in the right direction.
Lisa, this was a challenging time for you. Your back went out and you were, you know, debilitated. You could barely move. How did you get connected with Jamie?
Well, I work with somebody who is a patient of Jamie's, and when she first saw that I had trouble with my back, she said, you must call Jamie immediately. He's going to fix you. He has helped me with my back. He has helped me with my allergies, and she went through a whole litany of things that he helped with. And I resisted for a bit, and it took about a week, and I just wasn't feeling any relief, and so finally I called, and I saw Jamie, and I was very enthusiastic about him fixing me right away. But the first visit, you go through all the evaluation, and then you take x-rays and things to help you know what's going on and to help Jamie know what's going on. And then he adjusted me the week after, and within a couple of days I was starting to feel relief, and I was so happy, and I've been very, very pleased with the treatment.
You have a busy life, a lot of demands, work for a very active foundation here in San Diego, and as an office manager, your commitments are pretty big, and to be out of pocket it's just really not an option for you.
Absolutely. It was not possible for me to be missing work. I've never called in sick to work, and I had to call in sick one day, and then I was working standing up. It was really very difficult. So I was absolutely in need of treatment.
You were also very active in the community. I know that with the Chamber of Commerce, you served and did your duties. So when you were lying flat on your back and you were thinking, my gosh, I can't do anything, what kind of emotions were you going through?
Well, it's really terrifying to not be able to do your duties. I'm also on the Planning Commission of Chula Vista, and I was not able to go to one of the meetings, and I felt horrible because it was a very important vote on a historical piece. So I've been very happy to be helped, and I need to be able to be fully active in the community and in my job, and now I have absolutely no problems. One of the added benefits is that my sleep has been much better, and I've had now really restorative good sleep that's made me be able to be more effective in my job and at home.
And Jamie, this is very typical. When Lisa went for the first treatment, she did immediately notice some positive changes, and then just a few days after, the healing really started to take place.
Yeah, I've been doing this kind of work a little over 5 years and about 3,500 patients at this time. And you look at that broad spectrum of people coming in. It's the 55-year-old lady with MS. It's the 92-year-old guy with back pain. It's the 10-year-old with headaches or jaw problems. 90% of patients notice improvement within the first 30 days. I mean, we're talking about some people 50 years of trouble, and they notice things are moving in the right direction in the smallest amount of time possible. It's the bigger picture. People come in saying, fix me. I got this neck problem. I got these migraines. Can you help with that? But once they're starting to feel better, we then really have to ask them the question, what other things are you noticing? Now that your nervous system, chiropractors aren't bone doctors, we're nervous system doctors. Once your nervous system is working right, what other positive benefits are you noticing? Well, you know what? I'm a lot more friendly at work. I'm up and I'm moving around. My sleep is better. My allergies aren't as bad. I'm just less irritable. My relationship with my spouse has changed because I'm not miserable when I come home every day. That's the big picture of what this is about. And so that's why we've come on here, let people know what we do, and we try to make it really affordable for people to come in to at least find out if we can help them.
Speaking of that piece, you offer this incredible incentive for people to come to you, and you have to take advantage of it though today.
What happens is if you're listening to the show, you're curious to want to know if we can help with what's going on in your life, you need to call our office today. You're actually going to get our call center. First and foremost, we're going to get about 20, 30 phone calls right now. They are going to ask for a credit card number to reserve your appointment time. They're not going to charge it. All that we ask is you got to show up for your appointment because we schedule out time. You come in, we're going to go over everything. If it's something that sounds like it's going to work for you, we'll go over all the insurance questions, all the costs, all the frequency, all that stuff. We go over that. If it sounds great, we'll take the x-rays. It's only $49. If you don't like what you hear, it doesn't sound like it's a good time for you, there is no charge for the visit. Okay? You just got to show up and at least listen so we can explain what we do.
Jamie Kaiser, back into balance. Lisa, thank you so much. So glad that you're feeling better, and just a pleasure to hear about your positive story. Thanks, guys, and I know your phone's going to be ringing, so we better let you scoot on out of here. More information, go to our website at san diego6.com and click on San Diego Living.